So, good day, my name is Rachel Mahinay from the SN Mercer, and today I will be performing the nasal installation. Nasal installations are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with the sinuses, medical asepsis should be observed carefully when using nasal installations. For the assessment, assess the nares for redness, erythema, edema, drainage or tenderness. Assess the patient for allergies. Verify patient name, dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. Objectives: to instill directly the medication into the nostril or ears, to provide means for nasal evaluation to obtain desired therapeutic effect. Gathering equipment: check medication order against the original physician's order according to agency policy, clarify any consistencies, check the patient's charge for allergies. Step 2. Know the actions, special nursing considerations, and the safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. Consider the appropriateness of the medication for this patient. Perform hand hygiene to prevent the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare for the administration in the medication area. Step 5. Transport medications to the patient's bedside carefully and keep the medications inside at all times. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Step 7. Explain procedure to the patient. Rationally to gain cooperation and to allay anxiety. For the step number 8, offer tissue to the patient and ask patient to blow his or her nose. For rationally, blowing the nose clears the nasal mucosa prior to medication administration. For step number 9, have patient set up with head tilted well back. If patient is lying down, tilt head back over a pillow. Rationally, these positions allow the solution to flow well back into the nares. Do not tilt head if patient has a cervical spine injury. Sufficient solution into dropper for both nares. Do not return excess solution to a stock bottle. Returning solution to a stock bottle increases the risk for contamination of the stock bottle. 11. As the patient to breath through the mouth, hold tip of a nose up and place dropper just above nares, about 1/3 of an inch. Instill number of drops in one nares and 10 into the other. Protect dropper with a piece of soft tubing if patient is an infant or a young child. Avoid touching nostril with dropper. Another breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient's nares from injury during administration of medication. Touching the nares may cause the patient to sneeze and will contaminate the dropper. You should have patient remain in position with head tilted back for a few minutes. Rationally, tilting the head back prevents the escape of the medication. Number 13. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Number 14. Assist the patient to a comfortable position. This ensures patient comfort. Lastly, 15. Evaluate patient's response to the procedure and medication. The patient needs to be evaluated for any adverse effects from medication to our procedure.